a really big thanks to everyone for having us here. It's really amazing to come here and talk today, and especially reflect on the work that we've been doing at the Barber Institute and the work that myself and Jane have done together. So I am Flora Kay, and I'm the Head of Learning and Engagement at the Barber, which I'll explain more about in a second. And I'm joined by my colleague here, Jane.
That's great, Flora. So yeah, my name's Jane Nicol. I'm not a doctor, by the way. I'm just Jane Nicol. And when the project that, the projects that we're going to kind of share with you this afternoon, I was involved in when I was working at the University of Birmingham. I was a associate professor in the School of Nursing, and I was also nurse in residence at the Barber Institute of Fine Arts. Now I have moved out of higher education, and as Harriet said, I'm now head of learning at St Richard's Hospice, which is in Worcester, so that's our local hospice. So we've got some slides that we're going to go through. Flora's going to start off, and then I'll pick up. If you've got questions, please put them in the chat, and we'll try to monitor that as we go through, and there'll also hopefully be time for questions at the end of our presentation.
Okay.
Flora, over to you.
Sorry, can I just interrupt before you start, Flora? The slide on my screen is just a little bit, I'm losing the edges of it. So I'm just letting you know that I can't see the whole of it, and I can't reduce it. So I'm just not.
So if I click on there, how's that looking now, Harriet? If I go to the next slide.
It's fine. It's just if there's anything at the edges of the slide that you particularly need us to see.
No, I think we'll be okay.
Okay, great.
We'll see how we get on. Thanks, Jane. So I'll just talk a bit more about the Barber for those who might not be familiar, being based in Birmingham. So yeah, I'm talking to you from Birmingham today, just down the road from the Barber Institute. So we are an art gallery and concert hall. And as Jane hinted to, we're based at the University of Birmingham campus. So we're a museum based on a campus full of students, full of research, academics, but also we're a public building. So the picture that you see on the slide here is our really fantastic Grade 1 listed building. It was designed by someone called Robert Atkinson, who is a cinema designer. And there is housed our gallery and our art collection. So there's some pictures of the interiors that you'll be able to see now. But there in that space, you can find the Barber's collection, which consists of probably about 183 major paintings, ranging from the 13th to the 20th century. Many have dubbed us a mini National Gallery, although I was at the National Gallery yesterday and it feels very different. We've got over 1,000 works on paper, so drawings and prints, a fine collection of sculpture, and we also have one of the largest coin collections in Europe, so different ranges of coins there and decorative objects. So you enter this quite impressive space that we've got a mixture of teaching spaces, there's a concert hall, and then up on the first floor we've got this one floor of gallery space, which is all laid out in this beautiful big square. And you can walk around the galleries, and all of the artwork that you see here is laid out in chronological order. And I suppose want to start off talking a bit about our mission as a space before we go into talking about specific programs that we've been working on and myself and Jane have been doing together. So what the gallery do is really directed by our founder, which is someone called Lady Barber, and she found the Barber in 1932. And it was her mission to establish a museum for the purpose of the study and encouragement of art and music based at the University of Birmingham, because before this building even existed, there wasn't a central place for students, staff and public to, I suppose, come together at this area of Birmingham for that purpose. There we care for the internationally significant collection, and that's a huge part of our mission. But more than that, it's this envisioned mission of Lady Barber that it was going to be the hub of the social life of the university, and that's actually written in the original deeds that she set out, that she really, I suppose, visioned this gallery to be this hub where people came together, they connected, and we still really take this forward in our work today when we're thinking about working with people in the space. So the images that you see on the screen here is just a kind of small selection of things that a team do based there, which is the learning and engagement team. And our purpose, I suppose, is to fulfill this vision of Lady Barber, of connecting people to the galleries, to the artworks, to creativity, and to each other. And we do this with, I suppose, a wide range of what we call programs. So we've got different events, workshops, aimed at different audiences and working with different people. And then very much the core of it is our, I suppose, passion of working with others and connecting others, but working with artwork as well. And this really unique setting of working on a university campus. So Birmingham, I'm not sure if any of you have spent time in Birmingham, but the university is one of the first examples of a civic university, and it was designed for that purpose of connecting people all over. And I think working at a gallery there, it's really interesting because I find that purpose of a civic space still holds really true in what we're thinking about doing. I've just seen a comment flash up saying that they studied there 20 years ago and they did their final music recital in the Barber. Fantastic. Sorry, distraction there. So we have these programs that we work with people. That's a really broad way of putting it, I suppose. And we are a small space, we're a small gallery, so we probably only get a maximum of about 55,000 visitors to the space a year. But the team that work there have this really, I think, central passion of working with arts, health and well-being. And a lot of our practice and a lot of our study is based in that area. And this is really how Barber Health came to be. So I'll just say a few things about Barber Health. Barber Health is a program that was, I think, conceived before the pandemic, but very much then, I suppose, was created from the pandemic in terms of what was done afterwards. So the idea of Barber Health was to place all of our learning and engagement programs kind of under the umbrella of like arts, health and well-being being at the heart of our audience engagement, our learning and our outreach. And I think the prevalence and the profile of work in this area, it isn't a new concept, the idea of working with arts, health and well-being in a gallery. However, I think that post-pandemic especially, it just brought a new relevance to that area for the team, and especially the team at the Barber. And we were really questioning, I suppose, what role the cultural sector could have in helping society, not just to live, but to thrive and to think about recovery of pandemic as well. We were really starting to question, I suppose, what is the purpose of museums and galleries, and then thinking of this really unique setting of a gallery at a university. How can we slowly bring strands together? So we started this body of work and we split it up into 4 strands. It was the idea of we wanted to work with a nursing residence. So it was a play on the idea of, I suppose, an artist in residence in a healthcare setting is maybe something we're quite familiar with. But what happens when we work with a nurse in an art gallery setting, and what kind of research and ideas can come out? We had a really strong body of work called Memento Mori, which was about encouraging, I suppose, important and positive conversations around death and dying, not just within the university study, so working with maybe nursing students, but in our communities. Community outreach, so going out into places to work with people. And then we had this strong research strand of social prescribing as well, which again isn't a new concept, but it was thinking about what the role of galleries were in that now, coming out of the pandemic. So Barber Health was kind of made, umbrellaed, and we started working on this 2-year project with help from funding from Art Fund, their Reimagine and Respond grant. And that was the idea of how can galleries kind of help communities during this really specific time. So we had this 2 years worth of funding, and these are the programs that we looked at. So we started this work, and I think we'll reflect on a little bit of it. So I'll just talk a bit and then I'll hand over to Jane. But Jane became our nurse in residence, I suppose. And we had these aims, I suppose, of the programme. So to build and nurture new relationships with what we call, I suppose, underserved audiences. So we think a lot about access to culture and access to galleries in general, and maybe barriers that people have, not just physical barriers, intellectual barriers, societal barriers, and what skills do we need as a team in order to connect people together and connect people to creativity. We really care about positively enhancing people's well-being. That's central to everything we do. We really care about supporting engagement and creativity. And then I suppose we also wanted to think about how we could build our collection in there. And it's like, how can we use our collection maybe in a new and interesting way, and have people discover things about our collection that they might not know? Or people might think, oh, well, art history is not for me, but maybe I'll take away this aspect of working with the collection, and it is, and learning something new. So those were the aims of the programme. We started this body of work, as I said, and I think one of the first things that we did is that we did a series of community outreach projects. So we went into specific settings close to the Barber, so probably about 2-3 miles away in different areas of Birmingham, and we did a series of community outreach projects with care homes, but also extra care villages. So we had a mixture, and these I think consisted of kind of short-term projects, but also longer-term projects working with artists in these settings and working with people. The idea of it was to kind of have all those aims of Barber Health, but also eventually bring people to the Barber. And I think we've got to think back to the time where this project was done. It was just coming out of lockdown, actually. So the way in which we work with people and I suppose people were connecting had extra weight, but also prevalence and kind of different factors that we had to think about as a team to keep people safe, but also connect people, and the importance of connecting people. So I think linking that to our work, working with people with dementia, this had a huge focus in this area in our community outreach, and we were really thinking about the skills that our team had, what training we needed as a team as well, and how could we really support people at this time coming out of the pandemic. And there's just a few images here of work that we did within these settings with groups of people, which I won't kind of ramble on too much about now. And it was always our aim to kind of connect people back to the space, and we really managed to do that with the groups we work with, which again at the time it feels really different now working in engagement. We've got to think back to that time and everything that we had to I think the barriers that we had as well, and things did feel really different, and kind of the idea of connecting people back at that space. I mean, we worked with some groups where and staff included experienced this, maybe hadn't been out of their local area or kind of actually been out of their setting for a very significant period of time. And that was either because of what they were experiencing in themselves and the support and care that they needed as an individual, but also the added layer of the pandemic and considerations there in terms of how settings were operating, different levels of how settings were, I suppose, coming out of lockdown, and then obviously the kind of health and well-being support needs of individuals. So all of those complex things really, I think, affected how we were able to think about how to support people in connecting them in different ways, and with a hope that they would come to the Barber as well and experience a new space, which had great weight at the time. So I'm going to hand over to Jane now before I ramble on too much to talk about a few of the strands of the project, really specifically this area. So Jane.
Thank you very much, Flora. I think that with the community outreach, I'm just going to go back to that a little bit, because actually the programme that the Barber ran was really, it was incredibly well thought out. And I think you were underselling it a little bit there, Flora, because it was run over a period of 6 weeks with identified care home and or extra care housing. So how it started, so this was being delivered remotely. But we had somebody in the gallery who would walk around the gallery and introduce the works to the people who were in the care home or who were in the extra care facility. So they might not have been able to visit the Barber, but they got a sense of what the Barber was like and the atmosphere of the Barber by this little mini personalised tour. And then the group collectively chose a piece of art that they wanted to explore in more detail, and that was built on over the subsequent workshop sessions. And then you took it back out to the care. Where did you do the exhibition of it? Was that back in the care home and the extra care housing?
Yeah, it was back there. We did an exhibition then, and we also did, I think, a mini one in our kind of community room at the Barber. Thanks, Jane. It was a different time as well, but yeah, it was very much, we had to suddenly learn new skills overnight, and I remember thinking of, how can we get the gallery to people when we're not actually allowed to physically bring people out? And I think a lot of the team had just come out of shielding at the time, and it was thinking about how we could kind of connect all these things up. So yeah, we did a live stream from the gallery using a gimbal, and kind of thinking about how I mean, we had done a lot of that research at the time about digital access, and how actually I think the pandemic really uncovered a lot of different areas in which you could work. So there were weirdly positives at that time as well, because suddenly you could connect digitally, and I think in a way that we hadn't before. And live streaming into the care home was a really good example of that. And we were able to test that out in a few different settings, and make sure one of the team was there in the setting to kind of support people through that experience as well. So it was quite a logistical project in terms of, okay, well, what support do we need? What support do people need? How can we really make this, I think, the most positive environment that we can, and make sure that it's not just, I suppose, people think, oh, well, you're just going to kind of talk about artwork now. And it's like, well, no, because we need to think about the individual needs of those people who are in those groups, and how are they accessing it, and do they need anything else, or touch objects. We sent out kind of physical packs with different things in, and sensory objects, kind of thinking about linking the tours with that. But the live streaming, I think, was a really good example, I think, of just trying something new as well, and being able to reach more people because of that.
Yeah, excellent, thanks. So I'm going to pick up on a couple of things. The first area I'm going to talk about is student placements. I'm going to focus particularly on student nurse placements, and this started to happen before the pandemic, and the idea is that all student nurses undertook an elective, so they had a 4-week placement and they could choose whatever they wanted to do. And I was really keen to support students to explore a placement that was outside that kind of more traditional kind of clinical setting, to get them to think more broadly about health, more broadly about well-being, and their role within that as a student nurse. So it was a 4-week project. And we had you can see two of the students here, that's Hannah and Mayroon, and they were two students that worked with the Barber for 4 weeks. And their project was aimed at supporting the Barber to become a more dementia-friendly organisation, and also to think about how they could put together a workshop or an arts-based trail or activity that would be specifically for people who were living with dementia and or their carers. So we've had lots of conversations earlier on today about that kind of sensory, multi-sensory kind of experience for people who are living with dementia. And we spoke about Namaste Care earlier on. so Hannah and Mayroom really kind of rose to the challenge with this work, with this project. So they started by undertaking an environmental audit of the Barber to identify how dementia friendly the physical building is. But with a listed building, you're limited with the adaptations that you can make to that. So they had suggestions about how you could provide people who are living with dementia more kind of pre-visit information so that they know what the space is like when they're coming into it before they've actually visited. They went up to the Museum of Memories up in Liverpool, and that's been mentioned earlier today, to get some idea about how other museums are presenting their collection for people who are living with dementia. They also spent time at Moseley Hall Hospital and at a dementia cafe in Sturchley Baths to talk to people who are living with dementia and their carers to find out what they might look for and want when they were visiting an art gallery, and what would be helpful. So they then spent some time at the Barber looking at the Barber collection, and they identified, I think they chose about 14 works that they thought would be people living with dementia would be able to make a connection with, and how these could be enhanced through kind of multi-sensory experience. So for example, with the bust that you can see here, they were talking there about the textures on this one. So the medal, would they have a medal for somebody to hold a piece of material that kind of replicates this very kind of plush material that's on the bust here? So it was thinking about ways to get that across to engage somebody who's living with dementia in more than one sense. And as the quote, this quote that's on the screen just now is from Mayroom, and it was about just how the space of the Barber, for those of you who have visited it, you'll know as soon as you walk in, it's almost like you can just breathe out, and you can breathe out fully, and it's very calm space. So just how that also has a sensory impact and a positive impact for people who are living with dementia. This was another one of the works that they had chosen, and thinking about their ideas for this one were around, would you have a cup or an object to hold? So you've got that kind of tactile, you've got the coldness of that. How's that replicated in the painting? Would you have a lemon there for the scent of the lemon, and what memories that might evoke in somebody? And I think, there is some evidence around, if we think about sense memories, that they come from the parts of the brain that remain intact or are less damaged by a diagnosis and the disease progression of dementia. So actually using that kind of sensory impact, that sensory approach does trigger and target the parts of the brain that haven't been affected, so allows that person to kind of maintain contact with who they were before. So they did a lot of work around how they were going to how they would present this, and they had the workshop all planned to go, and then COVID came along, and that was kind of halted. But that is, that's work that the Barber's continuing to do around how to promote their collection, and part of that, and the outreach work that we then went on to do into care homes and into extra care housing did kind of pick up the themes of that. And one of the participants who was living in an extra care, he and his wife were living in an extra care housing facility. He was a gentleman who was living with dementia and had been an artist before, but since his diagnosis had stopped painting, and participating in the 6-week project had encouraged him to re-engage with painting. And he was painting. The workshop was running up to sort of in the autumn period, and then he sent one of his paintings off. I think it was to Alzheimer's UK, and his painting was used on their Christmas cards that year. And you think that's somebody who was able to re-engage with a really important part of his personality and who he was that he thought he'd lost. So that's the kind of power of, and it's one person, but that ripple effect for that one person, the impact that had on his relationship with his wife and his wider family and community is really important. So another strand, which kind of Barber Health, we had these 4 strands to begin with, but they kind of morphed over time. And following a Memento Mori workshop, which we had opened to the public, we were approached by an Admiral Nurse team lead from Herefordshire and Worcestershire, asking if we would be able to provide an art-based CPD workshop for her team. So this was coming out of COVID. The team had been working remotely. There was new members of the team that had joined during COVID, and they were back together a bit more, and they were wanting to just kind of reflect on the experiences of COVID, supporting people who are living with dementia and their carers during that time. And they said, would you be able to provide some CPD for us? So we were like, that, absolutely, we can do that. Let us know what your aims are as a team. So they gave us a brief, and we worked at that, and we used a patchwork poem approach. So that's an approach to poetry where a poem is created from either from other pieces of poetry or from other writings. And it's also known as kind of cento poetry, which is from the Latin word meaning which means patchwork garment. So we had, there was about eight Admiral nurses came along from a range of backgrounds. Some of them were mental health nurses, some were adult nurses, and the day started off with a gallery tour, and we were using some of the art pieces within the gallery to explore the nurse-patient relationship. So we started off with this, and we've mentioned this earlier on about, do I need to understand art? Do I need to know what this art, do I need to know the history of this piece to be able to understand it and to interpret it? So we wanted to kind of reassure the participants that they didn't need to come from that frame of reference, that they could come with it just as who they were and look at things and just bring their own interpretation to it. So we used some works to kind of explore that nurse-patient relationship, which for Admiral nurses is really crucial about maintaining that over a long period of time for the person, the carer of somebody who's living with dementia. So as I say, it was exploring the nurse-patient relationship. And the piece that you can see on screen, this is a sculpture. It's by Nom Gabo, and it's called Linear Construction in Space #1, and it's perspex with nylon monofilament. And we were actually lucky enough. The barber had asked an architect to try and replicate this work, which they couldn't do because it was so technical. But we had something that was very similar, so that the participants could handle that and look at it. And we were using this to talk about the nurse-patient relationship. And it's, when you look at this, it's under quite a lot of tension. And actually, sometimes in that relationship, you do hold, as a nurse or as a carer, you're holding tension. And who's holding that tension, and how do you alleviate that tension? There's also this really lovely shape in the middle, which is space, and how do you create space for people? So we used it to have lots of discussions about the nurse-patient relationship, which was that kind of introduction. And then in the afternoon, what we had done was we had identified 7 works from the Barber collection, which included works on paper, it included works in the gallery, it included sculpture, so some of it was more portraiture, landscape, abstract. And we had taken a selection of words that had been mentioned to us by the Admiral Nurse team, and we had kind of taken some of those and run with them a little bit. So the words we had chosen: disruption, stoicism, isolation, connections, distance, dissonance, family. And we had given them those words with the works as a prompt for their discussion, just to think about what words they might apply to the works that they had, and just as that starter for them to think about some of the works. So this is one of the works we had chosen, which is the Beach at Trouville, which is a lovely, it's a lovely landscape. And the words that we had put in there were, so the words that were associated with this were distance, isolation, connections, but recognizing that, like sand and the tide coming in and the sand moving, that those connections change over time. So the comments that you see are the comments from the participants on the day. So this is the feedback from the Admiral nurses when they were looking at the when they were looking at the works. So things like sometimes carers are not holding everything together, and what's their role in supporting that? How do they, go back to the sculpture around how do you maybe kind of reduce that tension? And then thinking about after this event, that actually maybe for me as an Admiral nurse, I'm going to be liaising with other organisations and thinking about how art can be used as a medium to support carer well-being. And then another work we used was Katha Kolowitz Help Russia, which is, you can see, quite a different piece to the beach at Trouville, much more kind of immediate. You can probably all have a bit of more of an, you've probably all had quite an emotional response to that piece. And the words that were, again, there was that kind of, they looked at, the participants looked at it from different perspectives. There was a sense of despair, but also a sense of connections, because there was hands reaching out, and who are you making a connection with? And again, these are comments from the participants at the time. So the participants had looked around the gallery with the words, and they had written about the works individually or in pairs. When they were up in the gallery, they'd looked at them and they'd taken the words as starting point, and then they'd extended that out into kind of larger sentences. And then when they all came back together down in the project space at the gallery, that was when they started to create their poem. So it was looking at the comments that they'd written, and then how to pull their individual feedback, their individual kind of thoughts and perceptions into to make something that represented them as a team. So here you can see that this is back in the project space, and they're just about to start putting together their patchwork poem. And I think, it was, what they were able to have kind of really quite thoughtful and meaningful discussions about their role as Admiral nurses, and about the rewards of that role, but also some of the challenges of that role. And also they were really good, the strength that they had within the team, because they recognized each other's individuality, and that their different backgrounds actually all brought them together, really, to make them into a really strong team. So on the next slide I'm going to show you is the poem that they put together and that they created at the end of the workshop, which they were going to take away and put up in their office, just as a reminder that, yes, our work is really rewarding. So you can see
Jane,
the poem.
Sorry, Jane, 5 minutes.
Okay, that's fine. This is the last slide, and then we'll just open it up for any comments or questions. So right. Where is the exit? Where is the exit? We asked them, do they know each other? They asked, is there a map or a plan? It's rarely like that. It's more like shades of grey. Should it be in colour? It's rarely like that. Whose hands? Are you falling? Are you catching? It's rarely like that. Shifting sands. So you can see how they've taken the images, the works that they used, shifting sands from the beach at Trouville, with the tide coming in and out, and the tide comes in and it goes out again, and the sands all moved and things have changed. Help Russia with the hands. Are you catching somebody, or are you the person that's falling? And that sometimes that shifts in a relationship. And I think I'm just going to finish off by saying, we've chatted about this quite a bit today, about one of the comments here on the screen is that you don't need to be arty to enjoy art. And I think that was, that's really important, is that it's not about, do you know about art? Do you know about who painted what? It's about what's that emotional connection that you can make to a piece of art, and that you can interpret it and it's meaningful for you. So I'm going to stop now. I'll stop sharing. We were going to chat about next steps, but actually, if anybody's got any questions for us, we'd be happy to take those for the next 5 minutes.
Great. Thanks very much, Jane. That's really good. There's been a really useful comment, I think, come in from Sue, saying how difficult it can be for carers to express their feelings without being worried that they're being seen as being resentful of their role. and how art, the role of art. And I wonder if you just maybe just comment on that. Obviously, if people have questions, please do put them in the chat or call out if we don't spot it. We've got about 5 minutes till the next one.
Well, I'd like to comment on that quickly. I think from my experience as someone who is an arts facilitator as well, I think that's such an important and valid comment from Sue. And I think what we've noticed a lot when we've had lots of different spaces for people is that say someone with dementia will be attending one of the spaces and their carer will be there supporting them. The dynamic between then the group is that space is just as much for the carer as it is for that individual who's being supported with dementia. And I think as people working in the gallery, we have a big awareness of that in our planning, and then how we're with people in that space. And that's something I've noticed increasingly more when we've had these spaces as well. It's not just focusing on one individual, but it's, I think, balancing a lot of different needs and emotions in that space. And yeah, that's just from my experience. I'm seeing that more and more present.
Okay.
I think there's also, you know, if the work, particularly I'm going to around Memento Mori, where we use artworks from the Barber to discuss loss, grief and bereavement and death and dying. I think there's something about people talk about things that are very personal to them, but they're almost not talking about themselves because they're talking about the work, the art that they're looking at, or the sculpture that they're looking at. So there's something about a little bit of safety there. I can talk about something that's personal to me, but I'm talking about it in relationship to this painting. So therefore, I'm not really talking about me. So if you're thinking about that, you know, they don't want to be seen as being resentful about being a carer, is that maybe being able to sort of separate themselves out for it and talk about something more objectively, it just gives them that safety element of doing it. I'm talking about this, but this is not necessarily about me. I'm talking about what I see in this piece of art and how that's replicated there.
Yeah, thanks for that. I think there's a question from Nikki just about how do families living with dementia access offerings from the Barber? That's a question I suppose, Flora, perhaps you might say, or at least give some suggestions.
Yeah, so the galleries are closed for some refurbishment at the moment, and then we're reopening again next March. And then we continue to hope to build on our Barber Health programme. So if you look on our website, there's on our kind of learning page, there's a learning@barber.org email, and that will go to myself. And we're a small team, but we want to bring even more focus to our Barber Health work from March onwards, and kind of support groups accessing the space. And we've got some outreach projects kind of lined up as well. So yeah, if you just look on our website, and it's learning@barber.org.uk, if you say hello Flora, I'll get back from them.
Okay, thank you very much. I think some really interesting and enlightening information there, but also some really emotional kind of depth to what art can do for us, and as carers as much as for individuals with dementia. Jane, you wanted to say something?
So yes, and actually it's a terrible faux pas, Harriet, because what I should have said was that actually for the Admiral Nurse CPD workshop, that the whole team was able to come to that partly because of some funding that Hope for Home provided, so that the whole team could take time out to attend that. So yes, that should have been my opening gambit, and I completely went out of my mind. I'm really sorry about that.
Don't worry. Thank you very much. It was a pleasure, and it's good to know that it's had such a positive effect, and hopefully you know, that similar programs can be developed for other groups and elsewhere as time goes on.